What if the pill you've been taking for years, maybe even one your doctor prescribed, was quietly weakening your heart? As a heart surgeon with decades of experience, I've cared for thousands of patients over 60 who come in feeling unusually tired, short of breath, or dealing with strange chest pressure. Most of them assume it's just age catching up, or maybe stress or diet, but time and time again, I've discovered something many don't expect. The real problem is often a common medication, not one meant for the heart, but something for sleep, blood sugar, or even everyday pain. These pills can seem harmless, but over time they may quietly strain your heart. This video isn't here to scare you, but to help you stay informed and safe. If you or someone you care about is over 60 and taking regular meds, please keep watching. You might be surprised by what pill number 1 turns out to be, because it's one most people would never suspect. 1. Calcium channel blockers, e.g., Verapamil, Diltiazem. The first pill I want to talk about today is a group of medications called calcium channel blockers. You might recognize names like Verapamil or Diltiazem. These are often given to treat high blood pressure or irregular heartbeats. And while they can be helpful, there's something important you need to know, especially if you're over 60. These drugs, especially the older versions, can sometimes slow down your heart more than it should. That might sound harmless at first, but over time, it can lead to some real problems. I've seen patients who felt constantly tired, dizzy, or lightheaded, but just thought it was part of aging. Some even fainted or struggled to catch their breath walking across a room. Others noticed swelling in their legs or ankles and didn't realize it was related to their medicine. Unfortunately, many seniors are put on these medications without proper follow-up or heart monitoring. So when these side effects show up, they're often brushed off as normal. But they're not always normal. These symptoms can be signs your heart is being slowed down too much. And if you're taking other medications at the same time, like beta blockers or certain antidepressants, this effect can be even stronger. If you or someone you love is taking a calcium channel blocker and you've noticed unusual fatigue, leg swelling, or shortness of breath, don't stay silent. Talk to your doctor. There may be a better option for your heart, or you may just need a lower dose. You deserve to feel your best, not just get by because of a medication you didn't even know was affecting your heart. Medications can be powerful tools, but only when used carefully. You know your body better than anyone. If something doesn't feel right, it's okay to ask questions. 2. Proton pump inhibitors, PPIs. Omeprazole. Now let's talk about the second common pill that might be weakening your heart without you even realizing it. Proton pump inhibitors, or PPIs for short. These are medications like Omeprazole and Pantoprazole, and they're often used to treat acid reflux or heartburn. In fact, millions of people take them every day, sometimes for months or even years. At first glance, they seem harmless. They help ease that burning feeling in your chest, and for many they offer quick relief. But what most people don't realize is that taking PPIs long-term can quietly create other problems, especially for older adults. One of the biggest concerns is that they can lower your magnesium levels over time. And when magnesium gets too low, it can cause irregular heartbeats, muscle weakness, and even make you feel more tired or anxious than usual. I've seen patients with heart palpitations who had no idea it was connected to their acid reflux pill. That's not all. PPIs can also mess with the natural balance of bacteria in your gut, and when your gut health is off, it can lead to more inflammation in the body. Inflammation has been linked to many chronic conditions, including heart disease. So while you may think you're helping your stomach, you could be quietly stressing your heart. I want to be clear. PPIs aren't evil, and sometimes they're truly needed. But they were never meant to be taken forever. If you've been on one of these pills for more than a few weeks, especially if you're over 60, it's time to talk with your doctor. Ask if there's a safer, more long-term way to manage your symptoms. Often, simple lifestyle changes, like eating smaller meals, avoiding food too close to bedtime, or identifying trigger foods, can work just as well without the risks. Don't settle for covering up the problem. Let's work on finding the root cause and giving both your stomach and your heart the support they deserve. 3. Decongestants, e.g., pseudoephedrine, phenylephrine. Let's move on to the third type of pill that can be especially risky for seniors with heart concerns: decongestants, such as pseudoephedrine and phenylephrine. These are the ingredients you'll find in many over-the-counter cold and allergy medications. You might recognize them in products labeled non-drowsy or maximum strength for stuffy noses or sinus pressure. Now I understand how tempting it is to reach for something quick when you're feeling congested, especially during allergy season or when you've caught a cold. But here's what many people don't realize. While these pills help open up your nasal passages, they do it by narrowing the blood vessels, not just in your nose, but all throughout your body, and that can be a big problem for your heart. When blood vessels get tighter, your blood pressure goes up. That means your heart has to work harder to pump blood through the body. For a younger, healthy person, this might not cause too much trouble, but if you're over 60, especially if you already have high blood pressure or heart issues, this extra strain can really take a toll. I've seen older patients who started taking these medications and soon experienced side effects like irregular heartbeats, shakiness, dizziness, or even anxiety and trouble sleeping. These are not just harmless symptoms, they're your body's way of saying, hey, something's not right. And just because these pills are available without a prescription doesn't mean they're safe for everyone. The truth is, over-the-counter doesn't mean risk-free. Many seniors assume that if it's sold at the drugstore, it must be okay. But your body changes with age, and what was fine in your 40s or 50s might not be safe now. If you ever need to take a decongestant, please don't just grab the first one you see. Read the label carefully. Look for warnings about high blood pressure or heart disease. And if you're not sure, ask your doctor or pharmacist before taking it. There are often gentler alternatives or non-drug remedies that can help without putting your heart at risk. You deserve to feel better without trading one problem for another. Your heart is too important. 4. Tricyclic antidepressants. E. Amitriptyline. Now let's talk about a group of medications that many people don't realize can affect the heart. Tricyclic antidepressants, such as amitriptyline and nortriptyline. These are older antidepressants that were once very common for treating depression. Today, they're still sometimes used, but not always for mood issues. In fact, many doctors prescribe them to help with nerve pain, migraines, or even trouble sleeping. But here's the concern. For older adults, these medications can quietly cause serious heart problems. They affect the way your heart's electrical system works, and that can lead to irregular heartbeats, dizziness, blood pressure spikes, and in some cases, even heart block, which is when the electrical signals in your heart don't travel the way they should. That might sound technical, but the symptoms are very real. Feeling lightheaded when you stand up, unexplained tiredness, or that odd fluttering feeling in your chest that just doesn't seem normal. I've seen patients who thought they were just getting older, when in reality, their medication was putting extra stress on their heart. What makes this even trickier is that tricyclic antidepressants don't always cause side effects right away. Even small doses taken over weeks or months can slowly create problems, especially for people who already have heart conditions or irregular rhythms. And sadly, many older adults aren't warned about these risks because these drugs have been around for decades. The good news? There are newer antidepressants now that are much safer, not just for your brain, but for your heart too. So if you've been prescribed one of these older medications, especially if it's been a long time since your last review, don't be afraid to ask questions. If you're feeling off, more tired than usual, dizzy, or you've noticed chest fluttering, bring it up with your doctor. You have every right to ask if there's a better, safer option. Medications should help improve your life, not quietly make things harder. Your heart deserves care and attention, and so do you. If you're enjoying this video so far, don't forget to hit that subscribe button so you won't miss any future tips on managing blood sugar naturally. And if you have any questions or something you're struggling with, drop a comment below. I read every one, and I'm here to help. 5. Sedative hypnotics, sleeping pills. Let's talk about something that affects almost every senior I've met: sleep. Many older adults have trouble falling asleep or staying asleep, and it's completely understandable. Our sleep cycles change with age, and things like stress, pain, or even nighttime bathroom trips can make restful sleep feel impossible. Because of this, a lot of people turn to sleeping pills like Zolpidem, often known by the brand name Ambien, or older sedatives like diazepam, Valium. These medications can help you fall asleep faster, but there's a hidden danger, especially when used long-term. You see, these pills don't just relax your brain. They slow down your entire nervous system, including your heart. And when that happens night after night, it can lead to serious problems. One big concern is that sedatives can make sleep apnea worse or even cause it. That's a condition where your breathing starts and stops while you sleep. You may not notice it, but your heart sure does. Every pause in breathing puts pressure on your heart and increases the risk of irregular heart rhythms, high blood pressure, and even heart failure over time. What's worse, sedative hypnotics can also interact with heart medications you're already taking, making side effects stronger and more dangerous. They can cause confusion, grogginess, and even falls, which are one of the top reasons seniors end up in the emergency room. I've seen too many patients who just wanted a good night's sleep, but ended up with heart problems or serious injuries because no one warned them about these risks. Please hear me on this. Sleep is incredibly important, but how you get that sleep matters just as much. If you've been using sleeping pills for more than a few weeks, it's time to talk to your doctor. Ask if there are safer, natural alternatives like guided relaxation, magnesium, melatonin, or behavioral therapy for sleep. You deserve to rest well at night without putting your heart at risk. As a heart surgeon, I care deeply not just about your heart, but your quality of life, and better choices today can lead to healthier tomorrows. 6. Thiazolidinediones, e.g., Pioglitazone. Let's talk about a medication that many seniors with type 2 diabetes are prescribed, but few are warned about: Thiazolidinediones, often called TZDs for short. One of the most common is Pioglitazone. These drugs were designed to help manage blood sugar by making your body more sensitive to insulin. On paper, that sounds great. But what many people, especially older adults, aren't told is that these medications come with serious heart risks. One of the biggest concerns is fluid retention. That means your body starts holding on to more water than it should, leading to swelling in the legs, ankles, or feet. At first, it might seem like just a little puffiness, but over time, that extra fluid can overwhelm the heart and lead to congestive heart failure, a condition where the heart becomes too weak to pump blood properly. What's worse is that early warning signs, like feeling tired or short of breath when walking, often get overlooked or blamed on aging. So the damage keeps building quietly in the background. I've had patients come in thinking they were just out of shape, when really, their medication was putting strain on their heart every single day. The truth is, many seniors already face a higher risk of heart disease. So when you add a drug that increases fluid buildup and places more pressure on the heart, you're stacking the odds against yourself. And the sad part? There are usually other, safer ways to manage blood sugar. Whether it's different medications, small changes in diet, or daily activity like walking, you just have to ask. So if you or someone you love is taking Pioglitazone or a similar diabetes medication, especially if there's any history of heart problems, please talk to your doctor. Don't wait until the swelling gets worse or your breathing changes. Early action could protect your heart and help you live longer with more energy and confidence. I'm not saying this to scare you. I'm saying it because I care, and I've seen what happens when these warning signs are missed. Your heart works hard for you. Let's do everything we can to take care of it. 7. NSAIDs, non-steroidal anti-inflammatory drugs. Let's talk about something that's probably sitting in your medicine cabinet right now. NSAIDs, or non-steroidal anti-symmetry drugs, like ibuprofen and naproxen. These are medications people often reach for when they're dealing with arthritis, joint pain, backaches, or even headaches. They're available over the counter and don't require a prescription, so it's easy to think they're totally safe, but for seniors, it's not that simple. Over the years in my practice, I've seen so many older adults take these pills every day for pain, not knowing that they could actually be putting their heart at risk. You see, NSAIDs can raise your blood pressure, cause your body to retain fluid, and even stress your heart. And the scary part? These effects can happen quietly, without you feeling anything right away. If you already have high blood pressure, or if you're on heart medications, these drugs can interfere and make things worse without you realizing it. NSAIDs can also damage the lining of your blood vessels over time, and even affect your kidneys, which plays a big role in keeping your heart healthy. So while you're taking them to feel better, they may be quietly creating more long-term problems. I understand that living with chronic pain is difficult, and it's important to stay mobile and comfortable, but there are safer ways to manage that pain, especially for older adults. Sometimes that might mean switching to gentler medications, doing physical therapy, or even using simple tools like heat packs or stretching routines. The key here is, don't go it alone. If you find yourself taking NSAIDs for more than just a few days, or if you're using them every day just to get by, please talk to your doctor. Don't wait for chest pain or swelling to show up before making a change. The earlier you speak up, the more options you'll have to protect your heart and stay healthy. Pain relief is important, but not at the cost of your heart. Your health is worth more than any pill. And sometimes the most powerful step you can take is simply starting a conversation. If you're over 60 and taking any of the medications we talked about today, please don't panic. And don't stop them on your own. But do something just as powerful. Start a conversation with your doctor. These medications were created to help, not harm. But as we age, our bodies change, and what once worked well may now be putting quiet stress on your heart. I can't tell you how many times I've seen older patients land in the hospital, not because of a new illness, but because their long-term meds weren't being monitored closely. These problems are often preventable. But prevention starts with awareness. And that's exactly why I made this video for you. Your heart works hard for you every single day. It deserves your attention and your care. Don't ignore warning signs. Ask questions, stay curious, and most importantly, take charge of your health. You have more power than you think. If you found this video helpful, please consider sharing it with a friend or family member. Someone you love might need this information today more than you realize. And before you go, don't forget to click over to the next video on our channel. It dives deeper into how simple daily habits can actually reverse heart aging. I'll see you there. Stay well, stay strong, and stay heart strong. Thank you for watching our video today. If you found this video helpful, please drop a like and subscribe button to support us. We truly appreciate you support, and it will motivate us to continue make more information video to help you all. Thank you, and goodbye.